And if she was not giving birth to, she will not be living. So good health for women is key. Thank you very much. Oh. We have another work here. This is also depicting women, because most of the artworks we'll be seeing here, they are all depicting women, because today we are talking about women and maternal health. We have Resilience by Bameyi Emmanuel. This is charcoal on canvas. And he's giving you an expression of a happy woman. She is happy, expecting good things. She could be a woman that is about to get married, and she will be thinking of family. Is she going to get the good health she deserves as a woman? This is another artwork. This is acrylic on canvas by Ogunwa Theophilus. And you can see this woman with her children. They are doing hand work. So if you don't have children, you might not be able to have a helper in your home. Thank you very much. This is another artwork by Ngozi Akonde. Here we are talking about joy, the joy of motherhood. This is fabrics, textile fabrics on canvas and acrylic. If you're able to give birth to a healthy child, you want to rejoice. You feel proud to have that child and want to show off your child. So good environment, good health gives you a healthy child. We are talking of Josephine Williams. She's showing the pain of womanhood, from puberty to labor to trauma. All it takes a woman to bring out children, to bear children in her life. Is she ready to go through it with the kind of condition we have in Nigeria? So it's a question for all of us to answer. Here we have Oswald Uruakpa. Oswald Uruakpa is a naturalistic painter. He's a very powerful naturalistic painter. And in his works, you will see real to life, almost photographic artwork, figures displayed. And if women are happy, if they have good health, they are happy. And they are always ready to celebrate with joy and with themselves. So this is being depicted on oil on canvas by Oswald Uruakpa. We have this. This is a woman. This is a woman. And what do you think she would have been thinking about? It's possible maybe she doesn't even have children. So who will help her? She's alone. So if she's able to have healthy children, she will have children to help and sell the goods. So we need good health for healthy children. We have Ella Onyebe, Women Voices. Here, women are talking, they are discussing, they are expressing themselves, telling us, yes, please, give us good hospital, give us good environment, let us have good health for us to be able to procreate in our society. This is oil on canvas, and Ella utilized the African motifs to bring out this design called abstract. It's an abstract work, but you can still see the figures and the expression on their faces. We can go this way. We have this artwork by Ekeneme. This is an acrylic color on canvas. Ekeneme is expressing women, showing women, creating awareness for all the challenges they are going through in life. So it's like women conference, discussing issues that affect them. I actually like this artwork because after talking and going through good health and everything, sometimes women go through after-birth trauma. And Oluchi Zoom is expressing this in this painting, that sometimes after giving birth, you have some issues that comes with psychological, it could be psychological, it can be mental, and sometimes this takes women back to the hospital. Still part of the trauma we go through to bring in children and to increase to humanity. We are talking of cataract chinyo here. This is also acrylic on canvas in pontulism. Chinyo is talking of safe place. When a child is born and the mother cuddles that child, the child is in a safe place. So when we have good health, we will have healthy children and they will be cuddled and be in a safe place. There's another woman going through the trauma of afterbirth and the trauma of even going through the labor pain. And this artwork is also oil on canvas by Nwachukwu Onora. And the expression tells us all. This is another artwork by Oswald Urakba. I was describing Oswald as a naturalistic painter. You know, he expresses that celebration, how women, you know, get involved in a lot of activities culturally and traditionally. So this is Oswald Urakba, and they are now, the title of this one is Before the Rain. The rain could be before you go to the hospital, before you take in, before you even get married. So this is Oswald Urakba. We have Mabel Chukwu here. When will my voice be heard? She's showing this mixed media with beads. She's showing a child that's already caged. Even at this age, she can't talk. So she's asking the society, when will my voice be heard? And this exhibition is telling us that no matter how difficult it is, your voice must be heard. We have this photography, and this is the artist Isioma Dogo. Isioma Dogo went through a personal experience. During childbirth, her intestine was perforated during the cesarean operation. And it took her 1 year to recover from this trauma. So the title of this is, I Could Have Been a Number. So the carelessness of our medical personnel put her in this condition for 1 year. After 9 years of childlessness, they would have taken her life for her to just have one. We have Achievable Loma. This is Women Voices, Women Conference, women discussing the issues of motherhood. This acrylic on canvas, And we can see different expression. The mouth says it all. Thank you very much. We have Bello Adedoyin, and she titles this New Life. That's the joy that comes with childbirth, with women having successful, childbirth without issues. So there's always joy. So Adedoyin is showing that expression on the woman's face, cuddling her newborn baby. We are talking of women voices to be heard. So when your voice is heard, we'll be able to produce healthy children. And this woman have talked, she has shouted, she has said, and to God be the glory, this is the generation of her children, which we all demand from our society, from our government. Thank you very much. I think we have exhausted some of the artworks, and you can go around, find time to appreciate the artworks and go through the descriptions to understand. I remain Dr. Ngozi Akonde. Thank you very much.
I think she deserves a better round of applause, don't you think so? I know Mr. Tony Azodo is here as well. Would you want to say a word as the chief curator? We'll call you up there to just say a word when we start. All right. Thank you so much, Dr. Akonde. We appreciate you and welcome everyone to this event. Your Excellencies, distinguished guests, ladies and gentlemen, may I respectfully ask that we all settle down, take our seats as we get set to begin this event in earnest. May I ask that we please settle down. There are still so many empty seats around as we welcome all our guests, all our partners, all those who have been on this journey of celebrating womanhood. From the first art gala to now, we appreciate you all for being with us. Please, let's just settle in. I'll just give us a few minutes to settle down, and we'll now get started. Thank you. While we're settling in, Obli's ensemble are taking us through What a Wonderful World. Please Please, let's settle in. Thank you so much.
I see trees of green, red roses too. I see them bloom for me and you. And I think to myself, what a wonderful world. I see skies of blue, clouds of white, bright blessed day, dark sacred night. And I think to myself, what a wonderful world. The colors of the rainbow, so pretty in the sky, and also on the faces of people going by. I see friends shaking hands saying, how do you do? They will say, I love you. Colors of the rainbow, so pretty in the sky, and also on the faces of people going by. I see friends shaking hands saying, how do you do? They'll say, I love you. I hear babies cry, I watch them grow, they'll learn much more, I'll never know. And I think to myself, what a wonderful world. Oh yes, I think to myself, what a wonderful world. Oh yes.
Wow, what a wonderful world. Give it up for Obli's Ensemble, please. Let's give them a round of applause for that. Indeed, Louis Armstrong came alive today, and we appreciate you for that. Your Excellencies, distinguished guests, ladies and gentlemen, we say good evening to you once again. From Nigeria Health Watch and MSD for Mothers, bringing us together as health meets art. Celebrating Womanhood, the Arts Gala, has the goal of creating greater awareness about maternal health issues, reaching audiences beyond the health sector. Now, this is the second edition. Last year, we were gathered at Thought Pyramid, and it was absolutely amazing. And I know that this year, at the Yaradua Center, will be even better. We're gathered here to elevate women's voices for quality maternal health care. And this is in line with MSD for Mothers advocacy, communication, and evidence generation pillar to increase awareness on the importance of integrating women's voices and experiences in shaping maternal health policies. March is the month for women. Yeah, okay, so I know the men in the room will be rolling their eyes at us right now and saying this March, Seth, that we keep celebrating. But when you have International Women's Day, March 8th, where we gave ourselves a big embrace for equity, to the two Mother's Day celebrations we have in March, it definitely is a month for women. And it's also necessary because every day, the man with a womb, the woman, should be honored for birthing life. Please, let's give it up for all women. The men, I can't see you clapping for the women. Okay, the men are just sitting still, but we'll get them into the program very, very soon. Distinguished guests, ladies and gentlemen, if the man with a womb is not heard, if the woman is not listened to, especially where maternal health is concerned, then we have a problem. And that is why, in celebrating womanhood, health has definitely met art to showcase various ways women are speaking and various ways women want their voices heard. And of course, various ways that we all, each and every one of us, can elevate our voices for quality maternal care. We welcome you all from your various walks of life, all those who are partners in this project, all our distinguished guests, the ambassadors here present, indeed government functionaries, and all our friends. Let's not forget the media partners who are also here with us, and every other guest who has joined us on this journey. It promises to be an evening of fun. Fun. It's Friday, by the way. Fun mixed with frank talk, mixed, of course, with art, as we saw beautifully taken through by Dr. Akonde earlier. And of course, we're going to have music, and of course, we're going to network and get to know each other more. It promises to be an evening where we elevate women's voices for quality maternal health care. My name is Inya Ode, and I'll be taking you through the events for this evening. Right beside me is Blessing. Please give her a round of applause. Thank you so much. Blessing will be here to ensure that this event is inclusive for those who are with disabilities, particularly those who are with hearing disabilities. Without wasting any more time, let me respectfully invite for the opening remarks today the Managing Director of Nigeria Health Watch, who have actually put this together alongside MSD for Mothers, Vivian Ihekwazo. Please, a round of applause for her. Let's make it warm. It's not easy putting together an event 2 years running. Thank you so much, ma'am.
Thank you very much, Inya, for opening this ceremony. I hope you can all hear. I know we have the water fountain, which may be a bit distracting, but that will be switched off shortly. Dear esteemed guests, partners, and friends, as Inya mentioned, this is the second year that we're hosting this event. I'm really pleased to welcome you on this very special occasion of our Celebrating Womanhood Art Gala themed Elevating Women's Voices for Quality Maternal Health Care. We are really pleased to have many of you here today. We have many distinguished guests. I'd love to call many of you out individually, but I fear that will take too long because every single person here for us at Nigeria Health Watch is a distinguished guest. So we welcome you all on behalf of my team today. Your presence here really is a testament to your dedication to women's rights. We're currently in International Women's Month. At the beginning of this month was International Women's Day on the 8th, when we really elevate and think about women and the role that they play in society. And we hope you have been able to enjoy the art displayed. As you will see, we have centered and focused all the art pieces around women, around motherhood, and around maternity care. This evening we're here to celebrate the beauty and strength of women, and to honor their essential role, our essential role in society. We want to use this as an opportunity to discuss issues really around maternal care and maternal health access. We know that Nigeria is one of the countries that accounts for the largest number of maternal deaths globally, and there are many platforms that we can raise awareness about these issues and highlight them. But today we've used the creative arts to really highlight these issues. And at Nigeria Health Watch, we've been really at the forefront of advocating for quality maternal care. It's not just thinking about access, but access to quality maternal care. And we are committed to promoting women's rights and well-being. And we believe that every woman should have access, every single woman, no matter what her financial circumstances, where she lives, her level of education, has the right to quality maternal care. Maternal mortality, is a significant challenge in Nigeria, and we keep on talking about the numbers. And, the recent WHO statistics points to the fact that we are not heading in the direction that we should as a country. But we really believe that with broader social and political engagement and more focused policy action, we need to collectively push individually and collectively as organizations and individuals to improve maternal health outcomes. So as I mentioned, the theme for this year is elevating women's voices for quality maternal care. So what really does this mean when we talk about the importance of elevating and listening to women? The goal of the Art Gala really is to amplify the voices and experiences of women using art as a means to raise awareness. We need to ensure that we have meaningful engagement, consultation, and listening to the perspectives and experiences of women. And ultimately, we need to find ways to advance maternal health equity. We recognize that integrating women's voices and quality improvements in healthcare, it has to be intentional. And there needs to be a more systematic process through which we capture the experiences of women, putting them very much at the forefront and really at the center of every solution and policy that we work on, our programs that we develop as partners. So really, the Art Gala aims to advocate for maternal health care that incorporates women's experiences and perspectives meaningfully, ensuring that their needs are reflected in programming. From a lot of the art pieces here, we've spoken to artists who we've explained to them that we want to use art to capture this theme. And with their creative thoughts, because we ourselves at Nigeria Health Watch, as much as we do a lot of things, we are not artists, but really broadening this discussion beyond the health sector. I think often we have these conversations, events, and we don't bring in other sectors that can play a critical role, and also to raise awareness amongst others who may not be aware of some of these statistics and issues in healthcare. So really, art for us, and the reason we're using this as a means of communicating this issue, is a unique form of expression that we can hopefully use to explain what we think are complex, often, socioeconomic and sociopolitical issues and make them more accessible to a broader range of people in Nigeria. And by portraying girls and women from their position of strength, we can create a larger collective of advocates who, we hope, will push for better quality maternal health care. So the artwork you've seen on display, we've been working with the Female Artists Association of Nigeria and National Gallery of Arts, who have provided and worked with us 2 years ago as well, to create a lot of these art pieces. And really, they serve as a reminder about the critical role that we all can play. But through the artistic expression and with their support in helping to create these art pieces, we hope we've been able to highlight and raise a lot of the issues that we want to focus on today. I said, art is a form of artistic expression. But the arts you see on display are also a testament of the power and creativity of expression. A picture can say 1,000 words beyond just explaining something. People can see an art piece and interpret it in different ways. And we hope that it brings out some of the issues we are here to talk about today. And so really, to end, and this is to all of us, if our voices as women are an essential part of our humanity, then we do lose some of our humanity when we as women are made voiceless. Women ultimately, when they seek care, just want to have access to respective health care. And women having voices is very critical, and our voices must be heard. Because what that means is, if women are not heard, the silence ultimately that is left, the vacuum, allows women to suffer in silence without any recourse because they're not being listened to. So really, I would like to use this opportunity again to thank you all for being here, to thank our talented artists for sharing their vision and talent with us, and for using their art as a tool for positive change. I'd like to also thank, of course, MSD for Mothers. This art gala is supported by funding from MSD for Mothers through their global initiative to help create a world where no woman has to die while giving life. Thank you to our collaborators and partners for their generosity of time and support. You contributed immensely in the successful planning of this event, and we're grateful for your commitment to this cause. Finally, of course, I'd like to thank my Nigeria Force team for helping to put this together. And I hope you all enjoy this evening and the festivities, and you're able to engage with one another. And I look forward to engaging with the rest of you, all of you, for the rest of this evening. So once again, thank you very much for coming.
Please let's make the applause warmer. Thank you. Thank you, Vivian. And indeed, it's an honor to be here to celebrate women, to celebrate womanhood, and of course, elevate women's voices for quality maternal health care. We move on very swiftly to hear from one who wasn't like this the last time we had this program. I believe, Vivian, if I'm not mistaken, Iyaduni wasn't this way the last time we were here, right? There was a, yeah, right. So she had a baby bump the last time, and it's great to have Iyaduni Olubode here with us, the Nigeria Director, MSD for Mothers. I'm sure she'll tell us about that, and how the baby is doing. Please welcome her for her welcome remarks.
Thank you very much. Good evening, everyone. Good evening, gorgeous Nigerian women. Good evening, handsome, supportive, and enabling Nigerian men. It is a pleasure, it's a distinct honor to be here, to be privileged to be giving this award on behalf of MSD for Mothers. MSD for Mothers, as some of you know, is an initiative of MSD, the pharmaceutical company, and it's an initiative focused on maternal health. We want to help to create a world where no woman has to die giving life. We feel that it's every woman's right, every Nigerian woman's right, regardless of her educational status, her earning, how much money she has in the bank. Every woman deserves quality maternal care. And so, this initiative was started with that in mind. Vivian has done an exceptional job laying the context. She said everything that I had to say about why it's important to give a platform to the voice of women, about how important it is. She talked about how important it is that we are intentional when we're elevating women's voices. When I thought about today's theme, there's a certain phrase in Nigerian lingo that came to my mind. Actually, two. There was sorosoke, which is the message to the women. You have to speak up. And then there was loud it. In Nigerian lingo, when we say loud it, it means elevate it, make it louder. And it's really because if we are to have any meaningful understanding of a woman's clinical experience, and if that is supposed to shape how we offer a woman care, if we are supposed to encourage and sustain women going into facilities to receive care, we need to understand how they receive the care, how they perceive the care that they receive. And that's why it's very important that we listen to women. I'm excited to celebrate with the entire Nigeria Health Watch team and all our stakeholders here present. Stakeholders from government, from the development sector, from healthcare workers to community stakeholders, the art community. Thank you so much. Many of you are already doing a great job listening to women, but I feel that we can do more. And you can extend this and make it a norm and get other people to start listening actively to the voice of women. And so I celebrate the diversity and the indomitable spirit of women all over Nigeria, represented by every single woman in this room, and also depicted through the art forms that some of you have already seen and will be experiencing today. I want to say thank you to policymakers, to healthcare workers, to development partners, our implementing organizations who are here present, stakeholders, community stakeholders, husbands, fathers, mothers, sisters, daughters, friends, who are interacting with these women and have the opportunity to listen and are sharing what these women are saying. Your voices are powerful. Your actions make a difference. We need to work together to institute systems that seek perspectives from women. When women speak, we must listen, we must share, we must reflect, and collectively we must act to ensure that no more Nigerian women have to die giving life. Thank you very much.
Thank you so much. You didn't tell us how the baby's doing.
Yes, this time, it was actually 2 years ago at the last event, I had a baby bump, but I'm happy to announce that I have a gorgeous baby boy, and his name is Baba Femi, and he sends his warm regards.
Great stuff. Thank you so much, Iyaduni. Please, another round of applause for her. Talking about a woman giving life and not having to die, but having the quality maternal care she deserves. I remember when I had my first child almost 15 years ago, and how that experience was eased and made even more beautiful because of the love and care that I received from the team led by one person. And I'm so honored and glad that that one person is here today. I'm sure she has been involved in so many deliveries over time. She has actually birthed so many babies. But I still remember that experience because it was my first. And I am so honored to have Dr. Mirame here. I know. Dr. Mirame is sitting right here. And she actually attended to me for the birth of my first child. Thank you so much, ma'am, for everything you did back then and things you're still doing now to ensure that women have quality maternal health care. Thank you so much. Please, another round of applause for her. And that goes to all those in the health sector who ensure that we have quality maternal care. But then, is it enough? Now that's the question. And that's why we need to keep elevating our voices, raising those voices to ensure that quality maternal health care persists. And with that, I'd like to invite to tell us a bit about this gala, letting us in on why we are here. I'm sure you've heard it over and over again, but this time you'll hear it with a twist as to why we are here. I'm so honored to invite the Senior Program and Advocacy Manager of Nigeria Health Watch, Onyedikachi Ewe, who will take us through this introduction of the reason why we're here. She looks absolutely beautiful, doesn't she? A round of applause, please.
Thank you very much, Inya. Good evening, distinguished ladies and gentlemen. It's such a great pleasure to have you all here this evening. I would introduce Celebrating Womanhood Art Gala in a very brief moment. The Celebrating Womanhood Art Gala is a concept of Nigeria Health Watch. We call it our Health Meets Art initiative. And this was conceptualized in 2021 with a goal to pull together stakeholders beyond the health sector to be advocates of quality maternal health care. Art has the ability to attract attention, evoke emotion, sustain interest, and stimulate memorable responses. And this is why we have decided to fuse arts into health, communication, and advocacy as a creative way to build knowledge and also to create awareness on maternal health issues. Typically, when we discuss maternal health issues, it's usually in a symposium, in a conference, in a room of many people from mainly the health sector. But you and I know that maternal health issues do not affect only people in the health sector. And this is one reason why Celebrating Womanhood Art Gala seeks to reach audience within and outside the health sector to have a larger pool of advocates for quality maternal health care. Now, the theme for this year's Art Gala is elevating women's voices for quality maternal health care. Vivian Iyadini, they've set the stage and said a lot about elevating women's voices, but I believe that we can't say it enough. We'll just keep reiterating till the voices are loud enough, till the voices are listened to enough to begin to bring the change that we are advocating for. If any progress is to be made towards achieving or contributing to the Sustainable Development Goal target of having less than 70 maternal deaths per 100,000 live births, then we must prioritize listening to women's voices to understand her unique needs, perspectives, experience, and challenges during and after pregnancy. The theme of this event actually recognizes the fact that women's experiences, women's voices, women's needs are a very great pointer to building very strong systems, designing systems that work for maternal health care. So this event is a one-day hybrid event, and in addition to the red carpet that we have had, the walkthrough session, we're going to be having curated conversations from MSD, for mothers, collaborators, and other development partners on how they are integrating women's voices in the work they do. And they will also expound knowledge on the importance of listening to women's voices. I'll share a quote by Dr. Wanda Barfield, and it's in line with our theme for today's event. And the quote says, "A woman knows her body. Listening and acting upon her consent during or after pregnancy could help save her life." Let us all be advocates of listening to women's voices for quality maternal health care so we can create a world where no woman has to die giving life. We'll be watching a video in the next few moments. This video is titled Push, and it focuses on the 3 delays that are prominent, and if these delays are mitigated, then we can tackle maternal health issues. We have the delay for the decision for the woman to decide to take or access health care. And this is one reason why we keep creating awareness, so that the woman is informed and already has that health-seeking behavior and knows where to go to access health care. The second delay are the barriers that she could encounter on her way to accessing health care. She might have decided to access health care, and there will be barriers along the way. And lastly, if she finally succeeds in accessing reaching the health facility, another delay is actually being attended to by a qualified and skilled healthcare worker and receiving the care promptly and in a quality manner. Please indulge us and kindly enjoy for the next few moments the video titled Push. Thank you very much.
Good job.
एक और बेबी
Exactly.
सीरियसली
Seriously.
सही बात है
Ti abonga mfazi. Ndiyajabula mfazi.
What vitamins?
You need to take your omega vitamins, you need to take your calcium, you need folic acid.
No swelling?
Okay, so
Oi, go jog.
Yo, sekula kangakana.
Kuranga nokwendele ekhaya.
Akiwa hapa kwaona.
Oh, are you pregnant? Cool. Really cool. Congratulations.
Thank you.
I've got 4 kids.
Really?
Yeah, they're pain in the butt, but you'll do fine.
We can talk about breathing techniques.
Oh my word! Oh, hello, look how big you are.
When you're pregnant, and you have to make a plan, and you have to do what you have to do to protect and provide for your young. And it kicks in, and it's a natural instinct, and you've got it. So I know that you're gonna be fine.
Caesar! Dad!
Driver! Where driver?
You can do this. You got this.
Focus! Get him
It takes a lot to be a mother. For some, it takes their lives. But thousands of health facilities are saying push. All our health workers say push. All our worldwide partners say push. Let's push until all maternal mortality is a thing of the past.
Wow. That video gets me all the time, and I'm sure it did for you too. It's called the Push video, and it does say quite a lot about where women are speaking, and we only hope that their voices are heard at such moments. Right now, we're going to voice it up, and to take us through this and let us know what exactly we're voicing up, or laudits, or Sorosoke, I'd like to invite Oluoma Omeje, Program Manager, Nigeria Health Watch. Oluoma, please a round of applause for her. Thank you.
Good evening, everybody. So for the Voice It Up, it's an idea that came up to showcase the work that everybody in the scene is doing to amplify the voice of women in improving maternal health in Nigeria. So MSD aims to help to create a world where no woman dies while giving life. And one of the strategic priorities that MSD for Mothers has is to integrate women's voices in shaping policies and decision making. So this year, the Celebrating Womanhood Art Gala is themed Elevating Women's Voices for Quality Maternal Health in line with MSD for Mothers pillars. So we, and by we, I mean MSD for Mothers and all her collaborators, as well as all the collaborators doing the work, understand the importance of partnership and collaboration in achieving this goal. So this informed us crowding in other stakeholders to contribute to achieve this common goal, which is to improve maternal health by listening to women and hearing their perspective and their needs, and incorporating this in the way that we design our programs and implementing it, and as well as, in a broader sense, the decisions that we make regarding in line with maternal health. So it is in this light that we have identified and worked with a few, for lack of a better way to put it, implementing partners working to come up with a piece, an art piece that highlights how they have incorporated women's perspectives, women's needs, and women's uniqueness in the way that we design our programs and in the way that we implement it at large. Some of the projects, please don't be offended if I don't mention yours, is the Adolescent 360, there's bodily, or maybe not project, the work in general. There's Adolescent 360, there's bodily autonomy that makes women and girls to know that they have full authority over their body. For Adolescent 360, it's creating improved facilities that are youth-friendly, women-friendly, where they can express themselves. We also have other ones that like community MPDSR, where if a woman dies, people in the community are held accountable, and the voice of women in terms of maybe those that are being subdued, even though they want to receive health care, they are not allowed to receive health care, their voice are held in their podium, and other ones that help to put women in the forefront from the norm that we know from our African cultural norm, where women are not allowed to speak, we are just suppressed, to the point we are now not just being suppressed and being hidden, we are now in the forefront, not just speaking for ourselves, but speaking for every woman. So it's in that light that we will have other, the partners that have been identified speak to the artwork in line with the work that they do. Thank you.
Thank you so much, Oloma. The first partner who will be speaking on the art is Moshood Ojo, and Moshood is the Senior MPDSR Advisor, Options. Mr. Moshood, are you here? Yes, I see you. Please, a round of applause for him as he speaks to art and voices it up.
Okay. Yeah, good evening, ladies and gentlemen. Yeah, so I'll be speaking to the act that we put together with Nigeria Earth Watch. Maternal death, which is the death of the woman while pregnant, during labor, or after delivery, is a pressing issue in many communities worldwide. And one of the most effective ways to address this global health issue is implementing MPDSR, maternal and perinatal death surveillance and response. So this art portrays how options through evidence for action, E4A program, uses community MPDSR, especially the social autopsy approach, to reduce maternal death in Soba community that has the highest maternal mortality ratio in Kaduna State, Nigeria. Here, community members grieving and preparing another maternal death for burial because maternal death is very high in this community. And the most common causes of maternal death in this community are home delivery and delivery by the traditional birth attendants, usually influenced by the decision makers in the family, the husband and mothers-in-law. The women are not allowed to make decisions on their own, even if it's related to their own ex. And here we have the social autopsy section, which is the key intervention of the community MPDSR model. The social autopsy allows the community, especially the religious leaders, the traditional leaders, and women leaders, as well as the healthcare workers, to come together in the community to discuss the root causes of maternal death, in line with the 3 delays that we just seen, that are the major causes maternal death. And they also lay emphasis on the bias, gender norms, and socio-cultural factors that are affecting women to make decisions in the community. The meeting also provides opportunity for the women to voice their concern about how their inability to make decisions is negatively affect their health, and also to make some suggestions. Following the implementation of the actions that are generated through social autopsy, we have observed a series of changes, a positive one in Soba community, which has reduced the maternal death. Here, we could see that men are now becoming the agent of change, following their pregnant women to the facility for ANC visit, facility delivery, and postnatal care. And also, through the intervention that generated from the social autopsy, a traditional birth attendance clinic that was responsible for most maternal death in the community was shut down. So what do women want? What do they want? They want the stakeholders and the government policy makers to replicate the community MPDSR model in other Nigerian states so that we can achieve skilled birth attendance, essential life-saving commodities and equipment, water, sanitation, and hygiene, as well as regular power supply at all levels of care. They also want community mobilization and sensitization, whereby the women will be empowered to voice their concern and also make informed decisions about their own health, so that that will increase the utilization of improved healthcare services, and women and babies will be alive. Thank you.
Thank you so much. Great, yes, you can. Thank you. All right, Vivian, please come forward. Thank you.
Thank you, Inya. I'd like to just crave your indulgence and just a slight alteration in the program. We'd like to welcome Dr. Shinkavi Bagudu, who has just arrived. Thank you very much for coming. As we all know, she's the First Lady of Kebbi State and also CEO of Medicaid. And she's what I would say one of our foremost advocates for maternal health, First Ladies Against Cancer. Does a tremendous work in absolutely elevating and ensuring that women's voices and needs are heard in the work she does. So we'd like to welcome her and thank you so much for coming, Dr. Bagudu.
Thank you very much, Vivian. Thank you, everyone. Good evening. It's a pleasure to be here, and I congratulate Nigeria Health Watch and the partners, MSD, for hosting their second celebration of women using the arts. We have a lot of maternal health issues across Nigeria and as indeed other low middle income countries. I have been witness to quite a lot of them in my state, Kebbi, but through interventions by various partners, the state government and even civil society, we're not doing so badly. We've been able to improve some of our indices. I particularly liked the last presentation about using the community ward committees, we call them, community development committees, to influence decision and social behavior. And that's exactly what we do and what is making a difference. There are various partners like USAID that are carrying out these programs. So we thank them. We can't do it alone, and we hope that they will continue to put hands together with government at all levels to bring change for women. Another thing I would like to talk about, particularly as we're talking about maternal health, is the unique opportunity that the maternal health clinics across our nation offer for our women to improve women's cancer outcomes. The maternal health clinics, particularly the family health clinics, are an opportunity for a lot of us to get cervical cancer screening, whereby this hasn't been well established in our health system, and it's not something that most women even know about. The outcomes that we're seeing in cancer, be it breast, be it cervical, are really enormous, and if we can piggy bank the cervical cancer screening and early treatment services in the maternal clinics, there would be a lot of impact on our cancer figures. So it's not a long speech, just to say thank you. Unfortunately, I have to leave before the end. You all know we have iftar, and I wish you a successful program tonight. Thank you.
Thank you so much, ma'am. Thank you so much, ma'am. That's Dr. ZSB. Please, another round of applause for her. Thank you for all you do for women. Thank you for all you do to ensure that women's voices are elevated for quality maternal health care. Right now, we're going into a panel session, and I would like to invite the moderator of this session to take charge from here. Kemisola Agbaoye is the Director of Programs for Nigeria Health Watch. Kemi, are you here? Please, let's give her a round of applause as she makes her way here. Thank you.
Good evening, everyone. Hi, everyone. Okay, good evening. Oh, yeah, I do have a voice, in case anyone was wondering. Good evening, everyone. We're going to have a very quick conversation right now. We'll be showcasing some projects that have intentionally elevated women's voices and included the needs and preferences of women in the design and implementation of their projects. And they are projects that are funded by MSD for Mothers. So very quickly, I would introduce my speakers to the stage, and I will tell you a bit more about their projects, and the conversation will start. Okay. So first I'd like to introduce to the stage Dr. Ugo Okoli. Please put your hands together for Dr. Ugo Okoli. Thank you. She is currently the Deputy Country Director for JPIGO, and she was the project director for the RICOM 3 project. RICOM 3 is reducing indirect causes of maternal mortality and morbidity. And the project focused on reducing indirect causes of maternal mortality and morbidity. You'll hear more about it shortly. Next, I'd like to introduce to the stage Dr. Uchenna Igbokwe. Please put your hands together for Dr. Uchenna Igbokwe. Dr. Uchenna is the Director of Programs at the Solina Center for International Development and Research. He has over a decade's worth of experience in designing and implementing programs. And the project we'll be talking to us about today is the Smiles for Mothers project, implemented by a consortium of partners, including Solina Center for International Development and Research. And the Smiles for Mothers project supported the federal government to reduce maternal deaths caused by postpartum hemorrhage. And you'll hear about how that project incorporated women's voices. So just so you know, the brochures that you have a summary of each of these projects, so you can just quickly go through it to get caught up. And it's on page 10, pages 10 and 11. So next I'd like to introduce to the stage Mr. Emeka Emmanuel Okafor. Please put your hands together for Mr. Emeka. He is a public health expert with over 18 years of experience managing public health interventions in Nigeria. And he is currently the project director for Integrate E. Integrate E project seeks to establish a regulatory system whereby patent proprietary medicine vendors and community pharmacists can provide family planning services in a way that it's closer to the women that need them. So please put your hands together for them once again. So I do have a fourth speaker that I would introduce. Unfortunately, she had to step out, but I think we can get started with the conversations, right?
No, it's on.
Okay. Before we get started, I was just wondering, you have drinks? Would you like to have a drink? Might want to relax a bit. This is meant to be a very relaxed conversation between you and everyone in the audience. So, and I would like to start with you, Dr. Okoli. Could you please tell us how you incorporated women's voices into the design and implementation of the RICOM 3 project?
Okay. So
this one.
Thank you. Thank you very much, Kemi, for the question. And I like the fact that you said the project. So we've all held this evening. It's so important. Voices when we are developing our project, when we are implementing. So the RICOM 3 project, I read it. It's all about reducing the indirect causes of maternal mortality. And it embarks on looking at risk factors such as high blood pressure, diabetes, obesity, anemia for women that are of reproductive age during pregnancy and otherwise. I don't know, I hope you can hear me. Somebody confirm.
Hi, everyone. Can you hear her, please? Can everyone hear
Somebody
her?
is shaking her head.
Oh, I see.
Maybe we need to...
Can you hear me now?
Yes,
okay.
I can hear you, actually.
Okay. So I was just saying that RICOM 3 project focuses on direct causes of maternal mortality. And we are, focused on prevention, risk factors such as high blood pressure, diabetes, anemia, and obesity in pregnant women. So how did we incorporate women's voices as we developed the project? One of the things we did is we worked in Lagos and the FCT. And one of the things we did was to actually, work in 2 local governments in each of those states.
Ikorodu and Alimosho in Lagos, and then Buhari and Amak in the FCT. So we selected a group of women randomly, about 600 of them, and actually carried out a survey asking them what they knew about these risk factors, how they cared for themselves, how would they use the hospitals, what the issues were. Amongst those women, we also did point of care testing, measuring blood pressure, testing for anemia, testing for diabetes as well among the women. Are we challenged?
Yeah, looks like.
Sorry about that.
Unfortunately, it looks like Nigeria has happened
Has
to
happened to all of us.
Actually, no, let's just leave it. Yes, apologies for the brief interruption.
It's part of doing business.
Can you hear us though? I know the hall has a lot of echoes in it. Can you hear my voice?
No.
Okay, I'm going to assume that since nobody answered, no one can hear me. Okay.